Hello, I'm Akshay Roy, and this is my tutorial on how to identify and treat the 3 stages of breast cancer. We'll start with the premature stage. Notice that the model includes a left breast and a right breast, the left breast representing the exterior, and the right is what will be occurring on the interior. The blue is the adipose tissue, the green are the lobes, and the purple is the cancer cells and tumor. With ductal carcinoma in situ, or DCIS, it is very difficult to detect when only doing a physical examination, because rarely will the tumor be big enough to form a lump under the skin. For this situation, we will pretend we used a mammogram to detect the tumor and the cancerous cells. The most common treatment for DCIS is a lumpectomy. So, wherever we detect the tumor, we would make an incision over it, move away part of the tissue, and locate the tumor. Afterward, we would use a cork and simply take out the localized tumor. For precautionary measures after the surgery, radiation will be applied to the breast. We will use external radiation, which will be administered on a cycle of approximately 5 days per week for 5 to 7 weeks. Now, with mid-stage breast cancer, detecting it may not prove as troublesome as with DCIS, or the premature breast stage cancer. Though the tumor may be as small as 2 millimeters, it may also be as big as 5 centimeters, with some spreading to the auxiliary lymph nodes, so the formation of a lump may occur. Treating a mid-stage breast cancer is very similar to that of treating DCIS. One would detect where the tumor is with a mammogram, or even where there is a lump, and first make an incision. Then we would go into the breast and remove the tumor by lumpectomy, as before with the premature breast cancer. Of course, radiation would also follow, but in addition, chemotherapy, targeted therapy, and lymph node biopsies will be administered. As stated before, lymph nodes may be affected during the mid-stage breast cancer, so a biopsy must be performed by making an incision near the lymph nodes, cutting through the tissue, and finally removing the lymph nodes. The biopsy does not prove that they are cancerous, but it will prove that other parts of the body may be affected. Chemotherapy may be given in order to promote cell death and growth, but as a result, the entire body is essentially poisoned. So another means that is not as aggressive is targeted therapy. Targeted therapy is when specific cancer cells are attacked by the medicine, which will prevent proteins that promote cell growth and division from being active. Lastly, severe breast cancer. When discerning severe breast cancer, the breast may have a variety of signs, such as redness, inflammation, one or multiple lumps, and swelling. Treatment is very difficult for this stage of breast cancer because it is spread beyond the breast. We will handle it first by detecting where there are lumps. Where there are lumps, we will make incisions and remove those tumors. We must also check the lymph nodes near the breast in order to remove them because they have most likely been affected and can most likely indicate that other parts of the body have been infected. After the sites are detected, what will most likely occur is a mastectomy, or a complete removal of a breast, due to the severity of this stage in breast cancer. Once again, the metastasis of the cancer cells make this treatment extremely difficult, and thus not only would we issue radiation afterward, but most likely chemotherapy, targeted therapy, hormonal therapy, and radiation, as well as other surgeries to the other parts of the body that have been affected. And that is how you treat and identify the 3 stages of breast cancer. And now it's your turn. Back to you, Akshay.